It's a pleasure to introduce you to Colorado Health Network as we highlight our prevention program services and the great work of our staff today. Colorado Health Network was founded in 1983 as an AIDS service organization, but with advancements in treatment and care over the decades, we've successfully transitioned to a health services organization with an emphasis on HIV. We're very proud of the fact that we've been able to add clinical services to the organization, which include a dental clinic, medical clinic, and we've greatly expanded our behavioral health care services. This is in addition to our traditional case management and supportive services, as well as our prevention program services, which include HIV and STI testing, as well as syringe access program services. According to surveillance data from the Colorado Department of Public Health and Environment, over the last 5 years, we've seen a 24% increase in new cases of HIV across Colorado. Communities of color are disproportionately affected by HIV transmission. In Colorado, 36% of those new cases came from the Latino or Latinx community, and 17% came from the Black or African American community. Those are far greater percentages than the respective percentages of general population. Men who have sex with men continue to comprise the greatest percentage of HIV transmissions in Colorado at 56%. In 2019, that was 265 out of 470 cases. We've found that our off-site non-clinical testing location in Denver has really proven successful in getting folks in the door and getting them tested. We are hoping that with additional funding, we'll be able to expand this model by opening a new location in the Denver metro area, as well as opening our first location in Colorado Springs. Next up, I'd like to introduce Matt Fisher, who will be talking about Hey Denver, our current off-site non-clinical testing location. Thank you.
CHN operates Hey Denver, which provides HIV testing, 3-site STI testing for chlamydia and gonorrhea, syphilis testing, PrEP navigation, and sexual health resources, and educational events. Hey Denver is a satellite sexual health services program in a non-clinical environment centrally located in Denver. It's promoting a unique environment for sexual health resources with a strong emphasis on creating a space that reflects the diverse communities served. Hey Denver is a public health intervention aimed at increasing access and engagement in HIV testing services and is strategically designed to mitigate common service barriers. Strategies for addressing these barriers include services that are zero cost to clients, late evening and weekend hours, and ongoing training for staff and volunteers on sex positivity, harm reduction, and cultural competency and humility, especially for LGBTQ communities. CHN has the organizational capacity to link Denver and Colorado Springs clients to inclusive and affirming care without large clinical systems of navigation or excessive red tape. This low barrier and accessible model is highly successful in ensuring that individuals who test positive for HIV or have a reactive STI test can engage or complete treatment and connect to ongoing prevention services that help support their sexual health needs. To tell you more, here are Lily and Randall.
Hi, my name is Lily Carrillo. I'm the Clinical Services Officer overseeing our medical, dental, and behavioral health programs statewide. CHN's medical clinic provides many essential healthcare services, including HIV and HCV care, PrEP and PEP, primary care services, and transgender and gender nonconforming care. We have coordinated linkage to care efforts between Hey Denver and our clinic. We work to eliminate the larger clinical system barriers in an effort to create a sex-positive experience for all of our guests, one that is low barrier and welcoming to everyone. Here to speak a little bit more about that is our Director of Medical Services, Randall McDavid.
Hello, my name is Randall McDavid. and I'm the Director of Medical Services at Colorado Health Network's Medical Clinic. I want to welcome you to our virtual world, and I want to take a few moments to go over the services that we offer at the medical clinic. For our patients living with HIV, I emphasize the importance of chronic disease management, attending appointments, and adherence to the antiretroviral therapy medications. Patients receive information such as the various available options for antiretroviral therapy. I also go over the possible side effects and drug-to-drug interactions, and we can't forget about the over-the-counter medications. I also go over health issues impacting people living with HIV, such as substance abuse, behavioral health, nutrition, and smoking cessation. In accordance with the HIV national guidelines, antiretroviral therapy is recommended for all patients living with HIV. Each patient who is receiving antiretroviral therapy or considering antiretroviral therapy are linked to an on-site adherence counselor who would educate patients regarding the benefits of antiretroviral therapy and to address strategies to emphasize engagement and care. For our PrEP patients who are referred to the medical clinic, before I actually prescribe PrEP, I conduct a medical history, assess for signs and symptoms of acute HIV and STIs, and I check for a history of kidney disease or bone disease. I do a medication review and risk for acquiring HIV. The clinic also conducts the following tests: HIV, kidney function, hepatitis B and C status, hepatitis A and B immune status, STIs, and pregnancy tests for persons with a vagina. CHN's medical clinic is able to obtain same-day laboratory testing and prescribe a PrEP medication on their first visit. CHN's medical clinic follows the CDC PrEP clinical guidelines, including HIV risk behavior assessment and quarterly HIV, kidney function, and STI testing. Recently, CHN purchased telehealth medical stations for each regional office, which will allow Colorado Springs to link patients seeking HIV for PrEP medical services to the medical clinic.
Hi there, my name is Melissa Chismar. I use she, her pronouns, and I'm the Prevention Services Manager here at Southern Colorado Health Network. I'm excited to share a little bit more about what our programs include right now and where we're headed in the future. So Rebecca Willie, who's our bilingual prevention coordinator, and I have been working on a project through an internal grant we received called the JB Innovation Grant that really allowed us to respond to a need that we were seeing here in our community and amongst the people that we test. Our clients had come to us and said, we really need expanded STI testing because the only other option in town was either extremely expensive or unaffirming through a crisis pregnancy center that did offer free chlamydia and gonorrhea testing. And so we kind of took that feedback and decided to run with it, and we, for the past couple of years in the grant work that we've been doing, have been focused on listening to queer community members and hearing about people's experiences with seeking sexual health services in town. And one of our big takeaways was that there's a lack of a community space for people to gather that is not focused on alcohol And there's also a lack of free and affirming testing here, outside of course, what we already offer, which is free HIV and hepatitis C. So what we did was we had surveys as well as needs assessments that were more conversations with people that are part of the queer community. 46% of the people we spoke to identified as Black and Indigenous people of color. 42% were of trans or gender nonconforming experience, and 96% were a part of the LGBTQ plus community. So we wanted to be very representative of who we talked to, because this is the population that we're trying to serve. People whose identities have been pushed to the margins are the ones that really need these services the most, because they've had negative experiences with healthcare. And that's why we're so excited to be able to look to a future where we can offer a queer-focused community space that's affirming to people's identities and also allows them to access the vital health care services they need, so they can get tested for HIV, for chlamydia and gonorrhea, all under one place, and most importantly, that they can find community with other folks who are like-minded.